I absolutely do not snore anymore.
I normally was sleeping 4 or 5, maybe 6 hours a night. Now it's 7 and occasionally even 8 hours. I find no difficulty with wearing it during the night while I'm sleeping, and certainly anticipate using it for as long as I'm around, because it has given me a good result as far as the amount of sleep I get, which is one of the large problems when you have sleep apnea. You don't get adequate sleep. And I think I'm sleeping about as well now as I have in the last 40 years.
My name is Phil Whitaker. I've had the appliance for approximately 3 years now. I had been having trouble sleeping. I went and had a sleep study done, determined I did not have sleep apnea. However, I was not getting sufficient REM sleep. I'd been exhausted in the afternoons. I never felt like I had a full night's sleep, even though I thought I was sleeping enough hours. After I had the appliance put in, I've used it every single night ever since, and my sleep has improved dramatically. It has been a tremendous benefit and tremendous aid, and I'm now rested, well rested every morning I wake up. The other benefit is it has significantly cut down on my snoring and has been, I think, well received by my wife because of that.
My name is John Colton, and I've been a patient of Dr. Meyer for many, many years after he took, since 1981, since he took over Dr. Paul Gledhill's practice, whom I've been with most of the time I've been in Phoenix. So anyway, I had a little sleep apnea problem that developed. I fell asleep one time driving, and fortunately nothing happened. I came to. It was just I was driving along and I blanked out for a short distance, and I woke up and my car was in a skid in the center of the road, so I didn't hit anybody. I immediately saw Dr. Meyer, and here I am.
We're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're discussing new treatment options for sleep apnea and snoring with Dr. Meyer here. Now, you say it could get worse. That means snoring turns into apnea. How? Help me understand that.
Yeah. Well, one of the fundamental problems is that the snoring is just a tissue vibrating in the throat. That tissue that's vibrating is weak. As you continue to grow with weak tissue, it's just going to get bigger and fatter weak tissue. So you'll have more problems with the snoring and the noise that it's going to create. So you'll have these horrific freight train sounding events that go on. And if you can treat that earlier and prevent all that from happening, you're going to have a whole lot.
So the tissue actually grows from the snoring?
Yes, it does.
And blocks
Yes,
the
it
air.
does. And one of the treatments that's common in the field surgically has a limited life simply because the tissue grows back. They're really not taking care of the underlying reasons of why they have problems, but the tissue will grow back in a high percentage of the cases.
So by doing this, by opening the airway, less of the movement of the soft tissue, does it shrink like a muscle that's not being used?
Yes, it does.
Or atrophy?
What happens, I believe, is that the muscle tone is increasing. Once you've created a better airway, more oxygenation's coming in, the tone of the muscle's improving.
Okay.
Now, it's a limit. So people can go, for instance, if they're regular wearer of the appliance, they'll be able to go 2, 3, or 4 days afterwards, having residual benefit from the increase in the tone in the muscle without the appliance. Now, so that will start to degrade, and then they'll certainly see the need for the appliance. They'll have a little bit of a relapse.
Okay, what about the results? You say some of the stories. What do people say after treatment?
Well, this one fella is a super guy. The night he put his appliance in, because he called it his marriage-saving anti-divorce type of an appliance, he has not snored once since he's put it in his appliance. It's a wonderful story. His wife was actually starting to sleep in another bedroom because his snoring became so loud, or she would kick him out of the bed and he'd have to sleep in a different bedroom. And since he traveled a lot, their sleeping in separate bedrooms wasn't too much of a problem anyway. But it's a very nice thing that it really does help bring couples back together.